Hello parents, myself Dr. Anupriya. This course is about spitting in babies. What's normal, what's abnormal. So we'll break it into what is spitting, why does it happen, recognizing the normal and abnormal symptoms, when as a parent you should be worried, prevention and management, and when should you seek medical advice. What is spitting? Spitting is nothing but effortless backflow of the stomach contents into the baby's mouth, usually accompanied by a burp. Can be small dribble to a more noticeable amount. It usually happens in an otherwise healthy infant in the initial first few months, and it's usually a normal part of digestive development. It is very crucial as a parent to know about what is spitting, what is vomiting, how to differentiate. So vomiting is forceful expulsion of the stomach contents, often with a significant effort. In spitting, the baby will be happy, whereas in vomiting, the baby will be very restless, will look sick. Even after the vomit, the baby will be feeling uneasy. Now, why does spit-ups happen? So the first and most common reason is immature digestive system. It is the immaturity of the lower esophageal sphincter. So this is nothing but a valve between the food pipe and the stomach, which usually in normal adults prevents the backflow of stomach contents, which is very lax in newborns. That is, it will be like this in the adults, whereas in newborns it is like this. So the stomach contents can easily backflow. Slightest pressure on the tummy, the content flows back. Second is overfeeding. Baby's stomach is very small. Overfilling them can easily lead to spitting up. Third is swallowing air during the feeds. So babies swallow a lot of air during the feeds, either due to improper latch or can be due to the nasal congestion. They latch, they leave, they latch, they leave. In the process, they suck in a lot of air. So when this air comes out through the burp, it takes along with it some stomach content, which comes out as spit-ups. Certain feeding positions. If you feed your baby in lying down position, chances of spitting are more. Like crying or coughing can increase the pressure over the stomach, which can lead to spit-ups. Some babies may be happy spitters. So they are playing, laughing aloud just during the change of diaper. Due to the pressure on the stomach, the contents come back. Recognizing what is normal versus abnormal. So usually the spit up amount looks more than what it is. It's usually just a tablespoon or two, but actually it is not. It's the same thing. It occurs usually during the feed or just after the feed while you're burping. If your baby is growing and gaining adequate weight, there's nothing to worry about. These babies are usually happy spitters. You'll see that the baby is laughing, playing. It's an effortless backflow of the stomach content. So these babies are generally content active. They'll meet all their developmental milestones, and the color of the spit up is usually white or clear, and it doesn't seem to bother your baby at all. Now, when do you consider spit ups as abnormal? Firstly, baby is having projectile vomit. It's the vomit that shoots out of the baby's mouth. It is not normal. It indicates a serious issue. Bloody or green vomit. So green vomit indicates bile, and bloody or coffee ground color vomit may indicate bleeding inside. When you see signs of dehydration in baby like sunken eyes, lethargy, decreased urine output, dry tongue and mouth, baby is not gaining weight or is losing weight. Excessive crying or irritability. Baby is fuzzy throughout the day. Even if you're trying to soothe the baby, it's not helping at all. Breathing difficulties like coughing or choking during the feeds, wheezing. These indicate more serious issues like GERD in baby, or what we commonly call as reflux. This is where the baby might need treatment. These red flag signs warrant immediate medical attention. This may indicate more serious issues in the baby like pyloric stenosis, GERD or any other serious problems. So seek help or go to your pediatrician. Now, how do you prevent spit-ups? First of all, if you're breastfeeding your baby, make sure your baby has a proper latch. So when your baby has a proper latch, it will minimize the amount of air which baby takes in, and that will minimize spit-ups. The more air baby takes, it gets trapped, and when it comes out, it brings out the stomach content. If your baby is still unable to latch correctly, connect with our lactation experts. Secondly, when you feed your baby, make sure that the baby's head and neck is a little upright, maybe 30 to 45 degree, and not completely flat. And Make sure to burp your baby after every feeds. And it's not that your baby burped once, you put your baby on the bed. No, you need to keep your baby upright for 15 to 20 minutes after every feed. If your baby is having frequent spit-ups, you can even burp your baby in between the feeds or reduce the volume of your feed. Avoid overfeeding. You can feed your baby in small amounts instead of large amount at a time. If you're bottle feeding your baby, take a slower paced nipple and keep your baby calm and relaxed during feeding. How do you manage spit-ups? So first and the most important thing, hold your baby upright for 15 to 20 minutes after every feed, irrespective of the burp. This will allow the stomach content to settle down and the trapped air to come out. Handle your baby gently post feeds. Slightest pressure on the tummy is going to cause backflow of stomach contents. So no vigorous activity, no tummy time, no massages right after the feeding. You can wait for 30 to 45 minutes for such activities. Avoid tight clothing. Put on loose fitting clothes so that it doesn't apply pressure over the baby's tummy. You can elevate the head end of the crib slightly to around 30 to 45 degree angle to prevent spit-ups. But make sure you follow the safe sleeping guidelines. Firm mattress, no loose blankets, pillows around, and baby should be laid on the back. You can also use a wedge pillow. Now when to seek help. Firstly, baby is having persistent and forceful vomiting. Unlike spitting up, vomiting is very forceful and not normal at all. It may indicate a serious cause. You see signs of dehydration in your baby like dry tongue and mouth, sunken eyes, lethargy, decreased urine output, poor weight gain. Baby is not gaining adequate or expected weight as per the age. This is when you need to report to your pediatrician. Spitting up may not be normal, it might be reflux in your baby. Respiratory symptoms like choking or coughing during the feed, or if baby is having wheezing, this indicates the baby has reflux. Even if you don't see these red flag signs, if you are concerned about your baby's spit up, please meet your pediatrician. He or she will guide you and reassure you.